Hi, this is Jessica DaMassa, and I'm here with Mario Schlosser. He is the co-founder and CEO for Oscar Health. Welcome, Mario. Good to talk to you.
Thanks. Great to be here.
Great. So I'm going to just jump right in, and I want to jump in on a question about health plan innovation. So we were just talking about the fact that you guys just closed a big round, $165 million at the beginning of this year. You're looking to expand, and I know you're also looking to integrate some new technologies. So how does a plan like Oscar, plan for some of these more, transformative technologies, the precision medicine stuff, the genomic testing? How are you guys planning on integrating into the health plan system?
Yeah, we think about it all the time. I mean, if you take me back to the original founding days of Oscar, the idea was that there is lots of good stuff happening in healthcare, lots of innovation on delivering care, essentially, starting from urgent care clinics to telemedicine to, polygenic risk scores and things like that. And yet, for some reason, the insurance companies, we thought, are lagging behind adopting and promoting some of these technologies and these new ways of utilizing healthcare, both because they seem to be slow in providing a better interface for the consumer to really utilize all this stuff, but also because you maybe never really want to deal with the insurance company unless they deny the claim of yours or something like that. So we thought if we can build an insurer that is engaging, that you want to start your healthcare with, and we give you free telemedicine, for example, a concierge team you can reach out to very easily and things like that, then we can be an interface and an enabler of these new kind of technologies. And so all the time we're thinking about should we let you upload more of your data into Oscar so our providers, our nurses can give you a better plan for how you should live your life even, and certainly utilize the healthcare system.
Now, we were talking, I am an Oscar member, and I'm very excited about all of these things, and I've utilized a lot of the services that you've mentioned already just there. So, really, one of the things that you guys have really, obviously built your business around is the Affordable Care Act. And I'm curious, as you're moving forward, like you said, you just raised this big round of money. So, and the Affordable Care Act, though, is starting to change based on the current administration. So how are you guys planning for your expansion efforts in light of all of these changes? And as a follow-up to that, what advice would you give to other entrepreneurs that are facing the same kind of challenges, only on maybe a smaller scale?
Right. I think the fundamental thing we always thought was, in my opinion, a lot of what's wrong in U.S. healthcare it was driven by the fact that you as an end user don't usually buy your own health insurance. You can now buy Oscar, you can now buy other direct plans, consumer plans, and it forces us to actually be directly responsible to your experience and give you a good experience. Otherwise, you're going to take your business elsewhere. And that is not the case still to this day for 200 million Americans who are in the commercial employer market, who don't have a choice in the matter really very much. And we thought that that's a very big thing holding the overall system back. And so, in my opinion, given everything you're seeing in healthcare right now, not just on the insurance side, there's sort of like a bursting at the seams where more and more of this consumerization will happen. That's without a doubt the case, and it'll force the big players to change in big ways. And so we thought if you take this all the way now and apply it to the ACA for us was a great entry window into the insurance market. Right. We were able to sell to individuals, like you and myself and so on, health insurance. That was powerful consumerization, but it's the first step, and no matter what regulatory tweaks you will have to the ACA regulations, and there are many bipartisan ideas. I think that's both parties agree on are good steps towards more consumerization. There will be a big market for individual health insurance. It may start looking different over time, but there will be a market there, and more of the rest of the market will have this kind of consumer pressure build up and will start to look like an individualized and consumerized market. And so that's how we've always felt about Oscar. It's great to have a platform like the ACA to be able to get into the market and grow the business. And we still think, by the way, even next year, that's a big market. It's going to be stable in most parts of the country. But there'll be many other ways in which the market will consumerize further.
Has JP Morgan, Berkshire Hathaway, Amazon called you for advice yet?
I probably shouldn't comment on kind of internal deliberations there. But we certainly, we talked pretty openly about observations we have in consumerizing and providing more transparency, I do think that's gotten heard, and I do think we've got a good reputation as somebody that's pushing the envelope on using technology to drive healthcare.
Well, yeah, without a doubt. I mean, you're one of the first to do that. I mean, there's not a lot of health plan innovation out there, and so I was just curious to see if they had asked you for some good advice. If they were to ask you for advice, what would you tell them based on the 6 years that you've had in the industry so far? What would you tell them? Is this harder than you thought?
It's simultaneously harder and easier. I'd say it's incredibly hard because it is a highly regulated business industry, obviously. So lots of really things you got to make sure you do really, really well and you button up on, and it is life and death really in the end. I mean,
right.
We have to manage members' healthcare, have to enable them to manage their healthcare in all kinds of difficult and pleasant life situations. Really pleasant, if you go to the hospital for pregnancy, for example, for delivery, that's a great experience. We have to make it better. If you're in the hospital for a disease, we got to help you make sure you get better and can facilitate everything we can facilitate there. So that makes it all very difficult, certainly, and you got to be very operationally tight. It's also a little bit easier almost than I thought because, the whole system really is, on the technology side, on the administration side, pretty backward still. Lots of FTP file uploads and
faxes.
Faxes, yeah, faxes, literally.
A lot of
exactly. And so sometimes the bar isn't that high even on doing something better and commonsensical there. And I do think that there is a huge pent-up demand from players in the system as well, ironically. Doctors, hospitals, hospital CEOs and so on, to make it better. They just don't like their claim system, are sort of like old-fashioned in the technology they're stuck to, and you got to break that open, I think. So advice to somebody else going into this space now, I think, is first and foremost, try to leverage what innovation there is in the space.
Mm-hmm.
Let us, for example, sell health insurance to people and give it a shot and it Amazon employees, and then you can also build your own stuff. But create that marketplace. I think that's the first step, really. Don't try to do things behind closed doors only for a small population, only for a bunch of rich analysts in New York City, for example. Do it in a way that it actually opens up the market and consumerizes.
That's great advice. Okay, so last thing for you here. So I understand that you were coding on stage here at Health Datapalooza, and so I want to hear a little bit more about that. And I'd like, though, in the context of this, so what we talk about on WTF Health is what's the future? And so, what's the future? What are you coding on stage at Health Datapalooza? That is so cool. Yeah,
that was very in the weeds, actually, but connected to an important macro point. The macro point, I think, about healthcare is the cycle time is fairly slow, I think, on the administrative side. There isn't a lot of experimentation, from what I can tell, going on what incentive works for providers, which incentives work for members, and so on. These are all things that have to work their way through lots of long reconfigurations of systems and actuarial math and things like that.
It's not responsive.
It's not responsive, exactly. And so that's not the way the technology industry works, where there's a lot more A/B testing going on at every point in time. And now, again, if there's a good reason for that, of course, because it's healthcare, you've got to be careful with how you sort of innovate and push the envelope, certainly, because it's people's lives. But there ought to be a lot more in experimentation on incentives, for example. And so we built a claim system internally that can be reconfigured very, very quickly and kind of using pretty much natural language coding there. And I just showed how in 5 seconds I was able to reconfigure the claim system and kind of show before and after, which is something that would take others a very long time to do. And it's just an enabler so more people inside of Oscar and even outside can more quickly experiment with new incentivization systems that others couldn't put in place.
Connect that dot for me. Just take that all the way. So if that happens and the incentivization is responsive like that, what's the next thing? And then what's the next thing? What's the next thing? What's the bigger outcome there?
Yeah, we really reduce the barriers between the players in the system. There's an odds, almost oftentimes antagonistic barrier between providers and payers in the system, right? The payer tries to downcode, provider tries to upcode, and that's sort of like the extent of their relationship oftentimes. Whereas in reality, many providers that are forward-thinking would like to get paid for different things that they do. They'd probably be happy to get paid less if somebody leaves the ER and they don't follow up, they forget to follow up,
right.
And they'd like to get paid more if they do follow up on ER visits and make sure there's no return to the ER and things like that. And they have that idea, they're closer to the front lines than in that case than we even are.
Right.
And so I would love for us to be in constant conversations, and we are with guys like the Cleveland Clinic, for example, with whom we built a plan together, about new ideas they have and how to pay their people differently and reimburse members differently as well. And so if you can simply have a dialogue around, hey, I would need this component here because I think it can nudge behavior in very interesting ways for my doctors, for my members, can you guys put this in place? That's a very nice cycle back and forth, iteration back and forth. That's got to be more of that in the system.
This is so inspiring because I truly believe that. No, it really is, because I think that the transformation of healthcare that we all want really starts with the transformation of the payment system. So thank you so much for sharing your insight with us. Such brilliant thinking. Such a pleasure to speak with you, Mario. Thanks so much. I'm Jessica DaMassa. Thanks for joining us.